Hello friends, today we are going to discuss MI, that is myocardial infraction, also known as heart attack. The notes of this entire lecture will be available on my Telegram channel. So do visit my Telegram channel to get the free handwritten notes of the lecture. So let's begin. Myocardial infraction, also known as heart attack, is irreversible damage of myocardial tissue caused due to prolonged ischemia and hypoxia. So what happens is there is irreversible damage that is caused to the heart muscles due to prolonged ischemia, that is, there is an insufficient blood supply to the heart muscle, and also there is a hypoxia, that is, there's insufficient oxygen supply. It is very obvious when there is not enough blood supply to the muscle, there will be insufficiency of the oxygen. So ultimately, it will lead to what? It will lead to death of the tissue. This is what we call myocardial infarction. There is irreversible damage to the myocardial tissue. Now come to the etiology. Coronary artery thrombosis, coronary artery atherosclerosis, or coronary artery spasm. All these things cause what? Coronary artery obstruction. You know, coronary artery is the artery that supplies blood to the heart muscles. So when there will be obstruction of the coronary artery, it will lead to death of the heart tissue. Now come to the pathophysiology. All the etiological factors that we mentioned above will lead to what? Coronary artery obstruction. This will cause blood flow reduced, and it will cause what? Hypoxia. Hypoxia, there is an insufficient oxygen supply. It will lead to what? Necrosis of the myocardium. There is a death of the heart tissue, and we call it what? Myocardial infarction. Now let's discuss the risk factors. It is seen in the patients with more than 40 years of age, and if someone have family history, they are more prone to this condition, MI, and it is more seen in males than in females because of the estrogen in females. Smoking, stress, hyperlipidemia, obesity, diabetes mellitus, hypertension, or physically inactive lifestyle, it will all lead to what? Risk factors of the MI. I would like to discuss with you the gross of this MI. Within the first 24 hours, there will be no clear evidence of necrosis. As soon as the MI hit the patient, within 24 hours, you will not see any clear evidence that will support the idea of necrosis, that necrosis had happened to the myocardial tissue. So you will not see any clear evidence of that. But after first 24 hours, there will be coagulative necrosis. I mentioned in my earlier videos that this coagulative necrosis is most likely to hit the organs like heart, spleen, and it is not seen in central nervous system, that is not seen in brain and spinal cord. Okay, now get back to topic. So you will see coagulative necrosis and also neutrophil recruitment. Since why we see neutrophil recruitment? Because now it is an acute condition. It has just happened. We are seeing it just after first 24 hours. So there will be what? Neutrophil recruitment. Once any acute condition converts into the chronic condition, it develops into chronic condition, there is then the recruitment of monocytes and lymphocytes. But in early conditions, there is recruitment of neutrophils. Okay, from first day to third day, you will see pallor of infected tissue. That is, there will be slightly yellow pale appearance of the myocardial tissue due to the coagulative necrosis. There will be slightly pale yellow appearance. And also, most important point, there will be myocyte nuclei and striations disappear. After third day, the condition had developed into the chronic condition. Now it is no longer an acute condition. After third day, it is developed into chronic inflammation. And now there will be macrophages recruitment. After 1 week, there will be bright yellow necrotic area. Coagulative necrosis had progressed due to which there will be a bright yellow appearance of the necrotic area. After a couple of months, you will see the affected area appears as a white patch. There will be a scar tissue formation, and this happens after a few months. Now, coming to clinical manifestations, the patient will come with a chest pain, dyspnea, that is, there is a shortness of breath, fatigue, there's increased sweating, nausea, insomnia, arrhythmia. Coming to diagnosis part, there will be pain, he may go in shock, and there will be low grade fever. Investigations include cardiac specific troponin. There will be increased the amount of troponin. This is responsible for contraction of muscle. Another test is CPK test, that is creatine phosphokinase. Actually, you're very aware of the word creatine. The creatine, what it actually does, it increases the ATP production. You will see creatine is usually taken in bodybuilding because it increases the ATP production. Now, the science is any tissue, any organ that is going through high stress, high workload, it requires more ATP production than normal. For that reason, body produces more creatine. You will see more creatine in that muscle, in that organ. So, what will it show? It will show injury or stress to the heart tissue. It was, if heart tissue is under high stress, there will be obviously increased levels of creatine phosphokinase. Also, you can examine through ECG. There will be ST segment elevation. You can see in this image. There will be increased ST elevation than normal. Also, there will be inversion of T wave, and there will be widened Q waves. Now, if I talk about complications, patient can develop arrhythmia, that is irregular heartbeat, cardiac aneurysm, which is mostly seen in aortic arch called aortic aneurysm, or cardiogenic shock. Now, treatments include thrombolytic agents, which will prevent the thrombosis of the coronary artery, anticoagulants, which will prevent the coagulation, antiplatelet drugs, antihypertension drugs, nitroglycerin, which acts as a vasodilator. This is all for this video. Thank you for watching.